The fourth reason, and the most important one, is that if you're throwing these terms around as a layperson, if you're calling someone a sociopath or a narcissist, statistically, it is just as likely or more likely that you are the sociopath or the narcissist compared to the person who you're using that term about, okay? There are two reasons for this, okay? One is you're often using it to talk about a family member, and again, these disorders have really high heritability, meaning that the proportion of variation in the population around this trait, so meaning like, it's a little bit hard. The language around it is a little tough, but basically there's like a 40 to 60% heritability for things like BPD and ASPD, depending on the condition and the estimate. That is moderate to high heritability, meaning the genetic component is really strong for these disorders. So if you're talking about a family member and you're calling them a narcissist, a sociopath, you're calling them borderline, it's very likely you have those same genes. And because one of the hallmarks of cluster B personality disorders is it's very tough for people to recognize their own toxic behaviors, it's likely that you're showing these traits and feeding into whatever dynamic you're talking badly about to a third party without even realizing it, okay? And this is true even if it's not a family member you're talking about, because any therapist who works with cluster B patients will tell you that they attract each other like magnets, okay? There are several reasons for this. One reason is they don't heed red flags that other people would heed. The other reason is that they they have this intense charisma along with like a need to connect with people, to be admired by them, to, in the case of BPD rather, to feel like you have that person to rely on who's not going to abandon you. They also tend to have different boundaries or no boundaries compared to the rest of society, which again can add to charisma, and it can create really intense relationships really quickly. So even if you're applying these terms to someone who isn't related to you by blood, if you keep interacting or forming relationships with cluster B personality disordered individuals, it's very likely that it's because you have a cluster B personality disorder that has not been diagnosed or that you didn't accept the diagnosis of. So long story short, again, this is the most important reason for why you shouldn't lightly use these terms like sociopath and narcissist as a layperson. Is it is just as likely that the person wielding those terms is the cluster B patient as it is that the person who they're talking about is. So you're kind of giving out a lot of sus vibes that any person with psychological or psychiatric training is going to recognize, that most of the people who are accusing 3 separate exes of being narcissists are not aware that they're giving out these vibes of. All right.